There will be another pandemic. There will be another crisis. And there will again be officials who insist that uncertainty must be hidden for the public's own.
That is the chairman of the Senate Homeland Security Committee on the 29th of July, 2026. The witness that morning was Dr. Anthony Fauci. But that sentence is not about him. It is about the next one.
I know you're invoking your Fifth Amendment right, which you have the right to be able to do constitutionally. But thanks for coming and be a part of this.
For 3 hours, the committee pressed Dr. Fauci on the origins of COVID-19 and on research funded in Wuhan. He invoked his Fifth Amendment right and answered none of it. This film is not about those questions. It is about the part of the record both parties agreed on.
History tells us, unfortunately, another pandemic is all but inevitable. The question is whether Congress and this committee will work to better prepare our country for it, or continue looking backward while our public health infrastructure crumbles around us. That is
The ranking member is a Democrat. He spent most of his opening statement objecting to this hearing and to the chairman who called it. Then he agreed with him about the only thing that actually mattered.
COVID-19 exposed serious deficiencies in our nation's public health infrastructure. More than 1 million Americans lost their lives, and this committee should absolutely continue to examine how we can better prepare our nation against future biological threats.
1 million Americans died. Nobody in the room disputed that number or what it revealed about the country's defenses. The argument was about what this committee should have done with the 4 years since.
The COVID-19 pandemic is not the first or the last public health crisis to impact our nation. In December 2022, I released a report that identified significant failures in our federal government's preparedness and initial response to COVID-19. This report contained 17 key findings. It's a very large report, which I have right here.
In December 2022, this committee published its own post-mortem on the pandemic. Not an outside review, its own. The ranking member carried a copy into the hearing room that morning and held it up.
It contains 17 key findings and corresponding recommendations, including the need to invest in sustainable domestic manufacturing capabilities for critical medical supplies, build the infrastructure needed to surge testing capacity for infectious diseases, and robustly fund public health emergency preparedness and responses across all levels of government. Unfortunately, multiple administrations, including the current Trump administration, have failed to fund or to reform our health preparedness.
Domestic manufacturing for critical medical supplies. The infrastructure to surge testing when an outbreak starts. Funding for emergency preparedness at every level of government. 17 recommendations written by this committee. Then he said what had become of them.
The administration has hollowed out the public health workforce. They have fired, pushed out, and cut funding for public health personnel, shrinking the CDC workforce by a quarter. Thousands of experienced scientists have left government service, and with them has gone critical institutional knowledge that cannot be easily replaced, certainly not quickly replaced.
Then he put numbers on it. These are his figures given under his own name in his opening statement. The committee called no witness from any health agency that morning to confirm them or to dispute them.
Staffing and funding cuts have slowed the federal, state, and local response to ongoing outbreak of a foodborne parasite, which has sickened thousands in my home state of Michigan, as well as across the country. At the same time, the administration cuts to global health programs and international partnerships have greatly reduced our ability to contain dangerous diseases like Ebola before they spread to our shores.
This is the part of his statement that was not about the past at all. It was about this summer, an outbreak already running through his home state, a containment line overseas already thinner than it was.
We should be examining whether our federal health agencies have the personnel and the resources they need to effectively prevent, detect, and respond to these threats. We should be asking how to strengthen our biodefense efforts to deter our adversaries and prevent biological attacks against our country, and how our government can better coordinate and communicate during public health emergencies.
Personnel, resources, coordination. deterrence against a deliberate biological attack. He called these the forward-looking matters, the ones worth the committee's time. The hearing ran another 2.5 hours and turned to none of them.
It is secrecy that destroys trust. It is arrogance that destroys trust. It is censorship that destroys trust. And it is the refusal to admit error that destroys trust. No scientist is above scrutiny. No government official is beyond accountability.
The chairman's warning was a different one. He aimed it past the witness sitting in front of him, at every official who will stand where that witness stood in the crisis that has not happened yet.
There are a lot of lessons that we've got to learn from this, that we should put into history to be able to determine what happens in the future. How do we respond in the future? How do we deal with something like this again? It was uncharted territory for everyone.
2 senators who agreed on almost nothing that morning agreed on one thing. It is coming. They disagreed about why the country is not ready for it. Neither of them decides whether it will be.